Hi, this is Sherry Shabowski from Medical Education in Minutes, and this is another in our classic clinical presentations. Today we're going to meet Kyle Orrick Stanos. First, let's meet Cindy. She's a 28-year-old female who presents to the hospital in labor with her first child. Now let's meet Kyle Orrick Stanos, a beautiful, healthy boy. Kyle was feeding very well. The mom and baby were very, very happy. 4 weeks later, Cindy is upset because Kyle is always crying. He's always starving. And then he vomits. Cindy's like, what is going on here? It seems like he's vomiting more than he eats. Then 20 minutes later, he's not acting sick. He just keeps acting like he's starving. And then he'll devour the bottle. Okay, this is getting ridiculous. I wonder if he vomits because he eats so much. This kid is always ravenous. Okay, this is too much. I actually think he's losing weight. So Cindy decides to call the doctor, and the doctor says to come in. They put him on the scale, and yep, he did lose some weight. But what an appetite he has! Yikes, there he goes again. On examination, there is an epigastric mass that feels a lot like an olive. Now the doctor is thinking about what she has. Okay, I have a 4-week-old who was born healthy at 39 and a half weeks. He eats plenty, but he seems to vomit more than what he eats. No bile in the vomit. It's been getting worse over the last 2 weeks. He never had a fever or diarrhea, but he does in fact have projectile vomiting. And I felt an olive mass in the mid-abdomen with obvious peristaltic waves visible. If everything that goes in comes back twofold with no bile, there must be a gastric outlet obstruction because what I'm seeing is all the saliva built up, all the GI juices, and the milk that he takes in all coming back. He has no systemic symptoms, so it's unlikely to be inflammatory. He's hungry, so seems otherwise well. And then there's that olive-shaped mass in the epigastrium. What could it be? Well, a normal stomach looks a bit like this. There's an esophagus that goes into the stomach. The pyloric valve decides how the chyme that comes in through the mouth will be distributed into the duodenum. In this case, we have a problem with pyloric stenosis, which means that muscle at the pyloric valve is greatly thickened, and there's a very narrow or no opening for outflow. Therefore, nothing is getting absorbed in the duodenum. The stomach stays full until he vomits, and nothing is getting absorbed in the duodenum because nothing is really passing through. Therefore, the weight loss. So pyloric stenosis most often happens in males, and it most often happens in white males, 2 to 6 weeks of age. There is the non-tender, firm olive on palpation, which is in fact the mass of the pyloric muscle. You'll see forceful projectile vomiting, visible peristalsis in the stomach. Children, when they're ill, a good tell is that they don't eat or they eat a lot less. This kid defies everything by being starving all the time. They become dehydrated. Sometimes they lose weight, Sometimes they just don't gain weight. They have decreased bowel movements because nothing's getting into the gut. This abnormality can be identified on ultrasound, fairly easy. The child needs IV fluid to repair the dehydration, and then he'll need to go to surgery. When he goes to surgery, what they will do is a pyloromyotomy, which means they're going to make an incision in that tight band of muscle. Once it's loosened, the milk will start to pass. Now let's take a look at Kyle a few months later. Kyle is doing great. Thank you, doctor. Thank you for learning with me today. This is another short from Medical Education in Minutes. There's more content on the website www.medicaleducationinminutes.com if you're interested. Thanks for learning with me, and I'll see you next time.